One local organization is working to end the opioid addiction epidemic here in Massachusetts. Good evening and welcome to 22 News at 5:30. I'm Barry Krieger. Opioid addiction is considered a public health crisis in Massachusetts. 22 News reporter Julie McDonald went to Holyoke, where addiction and recovery experts alike were searching for a solution to the opioid epidemic.
They had taken over my soul, basically, and I was unable to function without them. The easy way out was heroin.
Melissa O'Malley was a newlywed and mother in her 20s when she suffered an injury and was put on a prescription for painkillers. She said that's when her life stopped.
Nobody told me, when I went on these medications that I was going to get, one, addicted, two, have a really hard time coming off of them. I had to lose my children, my home, my life, and I had to be stopped by the cops.
She was hooked for 15 years and briefly turned to heroin. She's been in recovery for 5 years now and stays clean by helping other addicts and their families regain control of their lives. It's a journey familiar to millions across the country. Anti-addiction groups Wednesday called on the head of the FDA to step down from her position, claiming the agency's policies on powerful medications like Zohydro have contributed to the painkiller abuse epidemic. One Western Mass addiction specialist told 22 News he does believe the medical community has driven the crisis for years.
It is well recognized now that in the 1990s there were many shifts in how providers prescribed opiates for the treatment of pain. And there were many studies that were over-touting the success of those treatments as well as under-reporting the risks for addiction.
Dr. Rue said there have been some positive steps in limiting access to opiates in the community. The FDA recently made the decision to reclassify hydrocodone products from a Class 3 to Class 2 substance, which will put it under tighter regulations. Julie McDonald, 22 News.